Hi, I'm Dr. Sonia Bisaccia. I'm a board-certified family medicine physician here in Westchester, Pennsylvania. And this is just yet another reason that I don't take health insurance as a direct primary care physician, and an explanation of how and why people are getting weird surprise medical bills more than they used to in the past. So, I'm going to try and do this really quickly. Basically, I started noticing, I'd say about 8 years ago, I was working in a family medicine practice, and up until that time, I had been able to, when someone came in for their physical, I would order labs for their physical, like preventative screening labs, like look for their cholesterol, CBC, a CMP, liver, kidney function, the normal stuff every year at your physical to get checked, right? Preventative, like we're looking to see if there's anything lurking, like a chronic disease lurking around the corner. And it was fine. Insurance would pay for it. It was part of your physical. Well, about, I guess, a year and a half into doing family medicine, we started getting phone calls from angry patients who were like, this has never happened before. I'm getting, bills from my insurance for my labs that you did at my physical. Like, I called my insurance company and they were like, oh, well, we don't see why these tests were ordered. Like, it's not appropriate. Like, you're in your 30s. Why should you get a cholesterol test? Your doctor shouldn't have ordered that. You don't need it, and we're not going to pay for it. Preventative. Okay. So I started having to find codes, I'd have to assign diagnosis codes, sick codes, problem codes. Even though this is a wellness visit, I'd have to, for a while obesity worked. If someone had a little overweight, I would put obesity and I would code the labs under obesity. That worked for about a year and a half. That worked, and then it stopped working with no warning. And then it became like a shell game. So I'd have to try and find problems to get these preventative labs done. And basically insurance doesn't think labs should be done as preventative care unless you already have a problem. But that doesn't make sense. I make it make sense. It doesn't make sense. I want to get, before there's a problem, I want to see, anyway. What's the point of preventative care if you can't catch something before it happens? So flash forward, I'm now doing direct primary care, and I have negotiated prices with local labs, and my patients get special pricing. We go around insurance, so insurance doesn't dictate care. The same CBC that if we did it through the lab and your insurance said, we're not going to pay, I get that same CBC. Instead of $198, which is how much you would have to pay, I get it for $2.02. It's just another reason I do it.